Mumps is an acute viral infection primarily affecting the salivary glands, particularly the parotid glands, which are located near the ears. It is caused by the mumps virus, a member of the Paramyxoviridae family. Historically, mumps was a common childhood illness, but widespread vaccination has dramatically reduced its incidence in many parts of the world. Despite this, outbreaks still occur, especially in areas with low immunization coverage or among populations with waning immunity. Transmission. Mumps is highly contagious and spreads through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread through direct contact with saliva or objects contaminated with the virus, such as utensils, cups, or tissues. The virus typically incubates for 16 to 18 days before symptoms appear, though the range can be from 12 to 25 days. During the incubation period, infected individuals may not show symptoms but can still transmit the virus to others. Symptoms. Mumps is characterized by a variety of symptoms, which can range from mild to severe. The most common and distinctive symptom is swelling of the parotid glands, leading to puffy cheeks and a tender, swollen jaw. This swelling can occur on one or both sides of the face and is usually accompanied by pain when chewing or swallowing. Other common symptoms include fever, often low-grade initially, but can become higher with gland swelling. Headache, mild to moderate in severity. Muscle aches and fatigue, general malaise is common. Loss of appetite, reduced desire to eat is often seen. Pain while chewing or swallowing, due to inflamed salivary glands. In some cases, mumps may present without noticeable swelling, making it harder to diagnose, especially in adults. Complications. While most cases of mumps are mild and self-limiting, complications can occur, particularly in adolescents and adults. Some of the common complications include orchitis, inflammation of the testicles, which occurs in about 20 to 30% of postpubertal males. This can lead to testicular pain, swelling, and rarely, infertility. Oophoritis, inflammation of the ovaries in females, which is less common. Meningitis, viral meningitis occurs in a small percentage of cases and can cause headache, neck stiffness, and sensitivity to light. Encephalitis, inflammation of the brain is rare but serious, potentially leading to neurological problems. Pancreatitis, inflammation of the pancreas may occur, causing abdominal pain and nausea. Hearing loss, usually temporary, though permanent loss is very rare. Diagnosis. Diagnosis is often based on clinical symptoms, particularly the characteristic swelling of the parotid glands. Laboratory tests can confirm infection through serologic tests detecting mumps-specific IgM antibodies or through RT-PCR to detect viral RNA. However, in many cases, diagnosis relies on history and physical examination, especially during outbreaks. Treatment. There is no specific antiviral treatment for mumps. Management is largely supportive and symptomatic. Recommended measures include rest, allowing the body to fight off the virus. Hydration, drinking plenty of fluids to prevent dehydration. Pain relief, analgesics like acetaminophen or ibuprofen can reduce pain and fever. Cold or warm compresses, applied to swollen glands to alleviate discomfort. Isolation, infected individuals are advised to stay home for at least 5 days after gland swelling begins to prevent transmission. Prevention. The most effective prevention method is vaccination with the MMR, measles, mumps, rubella, vaccine. 2 doses are typically administered, the first at 12 to 15 months of age and the second at 4 to 6 years. Vaccination has significantly decreased mumps incidence globally, though outbreaks can still occur in under-vaccinated communities or among young adults in close contact settings like schools or dormitories. Good hygiene practices including frequent hand washing, covering the mouth when coughing or sneezing, and avoiding sharing utensils can also reduce the spread of the virus. Prognosis. Most people recover from mumps within 2 weeks without any long-term effects. Children generally experience milder symptoms than adults. Complications are more common in adults, but with timely supportive care, full recovery is expected in the majority of cases. In conclusion, mumps is a preventable viral disease that primarily affects the salivary glands. Vaccination remains the cornerstone of prevention, while supportive care is the mainstay of treatment. Awareness of symptoms and early diagnosis are key to reducing transmission and avoiding potential complications.